Hello, my name is Alex. I'm a BSM-1 student. This is my patient, Lisa Malberg. Do you give consent to me in this video?
Yes.
Okay, and here's the 360 room scan. Okay. Hello, my name is Alex. I'll be your nurse today. I've washed my hands. I've closed the curtain for privacy. Can you please state your name and date of birth?
Lisa Malberg, 5366.
Okay, and I checked the MRI number to make sure I have the correct patient. And today we're going to be doing a head-to-toe assessment. Now I'll be assessing for her positioning. She is sitting in upright and erect position. Now I'll be assessing your appearance, mood, and behavior. For appearance, she is clean and well-dressed and dressed appropriately for the season. For mood and behavior, she does look content and happy. Do you have any problems or any issues today?
No.
Okay, and that is appropriate for her mood and behavior. She is smiling and making eye contact. And now I will be assessing for level of consciousness and orientation to person, place, time, and event. And now I'll be asking, she is alert and awake. She is focused on me and my questions. Now I'll be asking 4 questions for the orientation. Can you please state your name?
Lisa Malberg.
Can you state where you are?
At home.
Do you know what time it is?
1 p.m.
And do you know why you're here today?
Head-to-toe assessment.
Okay, and she is an alert and oriented times 4 because she answered all my questions correctly. And now I'll be assessing her speech. Her speech has been clear and articulate. She's been answering my questions. And do you feel any pain today? And if so, can you rate it on a scale from 1 to 10?
I have no pain.
Okay, and now I will be obtaining a radial pulse. And I'll be making sure the arm is supported and making sure that you stay quiet and do not speak. Stay as still as possible. And I do feel that the pulse is strong and regular, so I'll count for 30 seconds and multiply my findings by 2. Okay, and I did get a reading of 35 beats per minute, so I'll multiply it by times 2, and I'll get 70 beats per minute, which is normal because the normal range is 60 to 100 beats per minute, and the pulse was strong, regular, and elastic. And now I'll be assessing your breathing pattern. It does look that your breathing pattern is normal, has a regular rhythm and regular depth. And now I'll be, since it is regular, I'll be counting for 30 seconds for your full respirations and multiplying my findings by 2. If you breathe deep in and out for me, please. Okay, and I did get 6 full respirations, and now I multiply by that 2, so I'll get 12 breaths per minute, which is normal because the normal range is 12 to 16 breaths per minute. And now I'll be obtaining a blood pressure reading, or making sure that the arm is at heart level. And do you know your normal blood pressure?
112 over 80.
Okay, is there any reason I shouldn't be putting this blood pressure cuff on you today? Any fistula or blood clot?
No.
Okay, and when I measure the blood cuff, I'll be measuring the cuff around 40% of the arm, and the bladder should be around 80% circumference of the arm. And now I'll be palpating for the brachial artery, and I'll be placing my cuff about 2 inches above the brachial artery, and now I will be getting a blood pressure reading. Okay, and I got a reading of 110/70, which is normal because the normal range is 90 to 120 systolic blood pressure and 60 to 80 diastolic blood pressure. And now I'll be assessing your head and your face. Your head is a normal cephalic shape. It's proportionate and symmetrical to your, and is midline to your body. And now I'll be assessing your facial features at rest and with movement. And at rest, I do see that your eyes are equal and symmetrical, your nose is midline, and your ears are equal and symmetrical because they align with your eyes. And now I'm going to test with movement. If you could frown, you could just puff out your cheeks, you could smile. And I can see that with movement, her facial features are symmetrical. And now I'm going to be assessing the skin on the face, and the skin is beige with some pink undertones and no color variation. And now I'm going to be assessing the hair. The hair condition is clean and dry, and the distribution is equal and even throughout. And now I'll be assessing for perla, which is pupils are equal, round, and reactive to light and accommodation. And now I'm going to be measuring your pupils. If you could stare over my shoulder. And your left eye is about 3 millimeters. And your right eye is about also 3 millimeters. They are both equal and round. And now I'll be assessing for direct light as I shine. You can look over my shoulders. As I shine my light in your left eye constricts. I shine my light into your right eye constricts. And now I'll be assessing for indirect light. As I shine my light into your left eye constricts. As I shine my light into your right eye, your left eye constricts. And now I'll be assessing for accommodation. If you could focus on my pen light as I move it towards your nose. And I can tell that her pupils did converge and constrict. Her pupils were equal reactive light and accommodation with indirect and direct light. And now I will be assessing your arms, your hands, and your fingers. And your arms, they do appear to be equal and symmetrical and even, and there does not appear to be any inflammation or redness. And for the color, it is a beige color with some pink undertones. There does not appear to be any color variation. There does appear to be some primary lesions in form of freckles on the anterior side of the arm and hands. They're small, pinpoint, round, flat, and brownish color. There does not appear to be any secondary or vascular lesions. And now I'll be palpating for any pain or tenderness. Any pain or tenderness?
No.
Okay, and I'll be palpating for any moisture or edema. I'll be using my thumbs and going distal. And I did not feel any edema or pitting. There was no moisture. It was warm and dry. And now if I could do test the hand grasp. And if you could grasp my hands for me, please. And the hand grasp was strong and equal unilaterally. And now I will be moving on to your posterior thorax. And I'll be inspecting the shape and configuration of the spine and the chest wall expansion. And now the spine is midline and there appears to be no signs of any curvature. And now I will be assessing your chest wall expansion. If you could breathe in deeply. And as the chest wall expanded, it did expand about 1 to 2 inches, equal and evenly, bilaterally. And now I'll be auscultating in 10 to 12 positions, listening for 1 full respiration. I'll be starting at the apex of the lungs, moving in a continuous pattern, and going to the sternal border and ending at mid-axillary. Okay, and I did hear clear lung sounds. There was no signs of any diminish or crackling or wheezing or any rhonchi, and all the lung fields posteriorly were clear. Now I'll be assessing anteriorly, and I'll be using 10 to 12 positions, listening for one full respiration, starting at the apex of the lungs and moving in a continuous pattern and ending mid-axillary. Okay, and I heard clear lung sounds, no signs of any diminish, crackling, wheezing, or any rhonchi. And all the lung fields anteriorly were clear. And now I'll be assessing the heart sounds in all 5 locations. I'll be starting at the aortic area, which is located on the right side, second intercostal space near the sternal border. And this is where S1 and S2 is heard, or the lub and dub sounds. Now I'll be moving on to the pulmonic area, which is located on the left side, second intercostal space near the sternal border. This is where S2 is heard. Now I'll be moving on to Erb's point, which is located on the left side, third intercostal space near the sternal border. This is where murmurs are heard. Now I'll be moving on to the tricuspid area, so on the left side, fourth intercostal space near the sternal border. This is where S1 is heard the loudest. Now I'll be moving on to the mitral area, which is located on the left side, fifth intercostal space at the mid-clavicular line, and this is where S1 is heard the loudest. And as I auscultated, I did hear S1 and S2, and I did not hear any signs of S3 or S4. And now I'll be moving on to the abdomen, and I'll be positioning my patient in supine position. I'll be draping a gown over her upper and lower halves of her body, leaving her abdomen visible on all 4 quadrants. And now I'll be assessing for the color. The color is a tannish beige color with some pink undertones. And there does appear to be no color variation. And for contour, I can see that it's flat and non-distended. And now I'll be using the umbilicus for symmetrical. And I do see that all 4 quadrants are symmetrical. And I do not see any pulsations. And now I will be, do you have any pain?
No.
Okay, and since there's no pain, I'll be starting in the right lower quadrant and going clockwise. And if there was any pain, I would end in the most painful quadrant. Now I'll be auscultating for the condition and characteristics of the bowel sounds. I'll be auscultating all 4 locations, 2 areas in 1 quadrant, starting in the right lower quadrant. Okay, and I did hear some clicks and gurgles, and I heard active bowel sounds in all 4 quadrants. And for the frequency, I got about 8 to 10 bowel sounds a minute, which is normal because the normal frequency is about 5 to 30 bowel sounds a minute. And now I'll be palpating for any pain or tenderness, and I'll be using 2 fingers, rotating in a circular motion in 2 areas in each quadrant. And I'll be using the right lower quadrant. Any pain or tenderness?
No.
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 Okay. And there was no interface. It had no signs of any grimacing, which is a negative sign of guarding. And there's no signs of any distension. Her abdomen was soft, and all the bowel sounds were active. All the quadrants were active. Now I will be assessing for the legs, the feet, and the toes. Okay, and for the legs, they do look equal and even and symmetrical, and it does look to be a tannish beige color with some pink undertones. No signs of any color variation, and there are signs of venous patterning in form of varicose veins. They're bluish purple color. The hair distribution is equal and even throughout. The hair follicles are distributed equally. And now I'll be noting any primary, secondary, or vascular lesions. There's no primary, but there is a secondary lesion in the form of a tattoo on the dorsal side of her right foot. It is a large butterfly shape. And there is no signs of any vascular lesions. And now I will be palpating for any pain or tenderness. Do you feel any pain or tenderness?
No.
Okay, and I'll be palpating for any edema or moisture. I'll be using my thumbs and moving distal, moving along the tibial. I did not feel any edema or moisture or any pitting. In the moisture, there was none, and it was warm and dry. And do you have any numbness or tingling?
No.
Okay, if there was any, I would know how far it went up, and I would notify the doctor. Now I'm going to be assessing the heels, toes, and between the toes for any decubitus, and I do not see any breakdown or infection on the heels, toes, or in between the toes. And now I'm going to be assessing the plantar dorsiflexion. If I could have you push up if I push down. And the flexion was strong and equal and even. And now I'm going to be getting a pulse for the posterior tibial pulse. I'm going to be using my 2 fingers, index and middle, and the posterior tibial is behind the medial malleolus. And now I'm going to be getting a pulse. And the pulse is regular, strong, and elastic, and I grade it A+2. And now I'm going to be getting a dorsipedius pulse, which is located between the big toes, and I'll be palpating the pulse. And I do feel that is a regular, strong, and elastic pulse, and I'll grade that A+2. And now I would assess any, there's use of any oxygen IVs or any Foleys or any other accessories. And now I'll be assessing my patient for comfort. I'll be putting the bed in the lowest position. I'll be giving any call lights and any items in reach. I'll putting the side rails up ×2, and I'll be documenting my findings.